Welcome to your Farm and Home Show. My name is Joanna Coles, and today we're visiting with Dr. Michele Arnold. She's with the University of Kentucky Extension Ruminant Veterinarian there. Now, today we're going to talk a little bit about lameness, and a lot of times we maybe overlook the importance of feet and structure and stability for those animals. But if we think about it, there's a lot of weight. This is how they get to feed water. It's essential. And the more we're kind of vigilant and watching and making sure those stay sound, the better off and the longer they'll be able to stay in our herd.
And not to neglect a lameness case if one does occur, because it can lead to infection in the deeper areas within the hoof, and then those are very difficult to treat. When you have animals standing in mud, lots of bacteria, lots of access, and the skin is softer, so much easier to have a little nick or a scratch that'll lacerate the skin and allow those organisms to come in. And then we have some farms where ponds are used for water, and the cattle end up standing in those ponds, which are really basically have lots and lots of organisms in there, bacteria, protozoa, that can infect the hoof.
And for people to understand, I think they have to kind of understand the structure of the hoof. And I know you have some visuals to kind of help us through that.
So if there's going to be any kind of infection and associated swelling, it's not going to be within that, because that's a hard shell. It's going to be above that area. So we talk about the coronary band. That's the area where that's the growth of the hoof comes from that coronary band area. That this is the sole. And we talk about the wall. So this is in the terminology, this would be the axial wall, which is in the middle. Your abaxial wall is on the outside. This would be a left hind foot. And so this is going to be your lateral claw, your outside claw. This is going to be medial. This is your inside claw. And then the last thing probably that's important is this interdigital space. So each claw is a digit. So this is the space in between. It's called the interdigital space, and that's the cleft. Maybe more importantly is looking at these deeper structures. So this would be a cut section of the hoof. So again, this is the wall here. So this is the hard part of the hoof. But if you look, it just is not very far till you get to the bone. So this is what we call the pedal bone. Here we've got a joint space right here, and this number 8 right here is the ligament, the flexor tendon. So these deeper structures are what we really don't want to have infection. We don't want infection to make it in here. And this infection in these deeper structures is called deep digital sepsis.
Is that where we see the animal limping, having a hard time walking?
Exactly. A lot of the lameness exams are done by the producer initially. So that's where we have kind of a way to go about a lameness exam by first examining the hoof for swelling. You just want to see, is that hoof swollen or not? And that will give you a pretty good idea of if there's infection. And then we look at, is the infection more on one side or the other, or is it actually the same? Is it a symmetrical swelling? If we are looking for swelling and we see that there's swelling and we see that it's symmetrical in the foot or above the foot, then it's more than likely foot rot, because foot rot begins in that interdigital space. And so the swelling is even on both sides. Whereas if you have infection on one side or the other, that swelling is not going to be symmetrical. It's going to be much more on one side of the hoof. And so if you see an asymmetrical swelling, that's the time to call your vet. Don't waste time just using antibiotics, because that's going to need some drainage. It's going to have trimming. It's going to have drainage. That infection's got to have a way to come out of the deeper structure.
And so we need to contact our veterinarian if it's not asymmetrical.
Because the sooner you get to that, the better chance you have of actually having recovery, full recovery.
We appreciate you watching the Farm and Home Show and hope you have a great day.
Thanks.